What's up, you guys? Welcome to another episode of the Jessica Kent podcast. I'm your host, Jessica Kent. Y'all know that on YouTube. But in today's episode, we're going to be talking about prison dentistry. And if you guys have been following me for some time, you know that I've had a little, horror story situation when it comes to dental work in prison and outside of prison, actually. I have the worst luck. But that's what today's video is going to be. I'm going to be interviewing a prison dentist, and I'm so excited about it. If you guys want to follow me on any other social media platform, TikTok, Instagram, Patreon, that's $2. It's only ever going to be $2. All of that is linked down below, as well as my vlog channel and my podcast. I am also a proud partner with Groups Recover Together, and you can find my landing page of them in the description box of that video. Oh my God, that was a lot. Okay, let's kick this thing off. Dr. Ashley, thank you for coming on the show. How are you?
Hey, I'm good. How are you?
I'm so good. And I'm so happy that you're here. I'm so excited to talk to you about this. I don't think a lot of people understand what goes on inside a prison, period. But when it comes to medical care, oh my gosh.
Also, yeah.
I guess the first question I have for you is, how did you even get into prison dentistry in the first place? It's kind of random, right?
So awesome question. I was in dental school and actually graduated in 2020. So I'm a fairly new dentist. But as part of our dental school training, we treat patients and do procedures for our last 2 years. So our third year and our fourth year of dental school, we're treating our own patients in our clinics. But that's not usually enough. You don't learn, just from working in the dental school clinics. So they send you out, and it's called externship, and you go somewhere to work for about 3 to 4 months, and then come back and continue your care with your patients in your dental school. So when I was choosing my locations, I chose to work in a federal medical center. So a federal medical prison in Western Massachusetts. I live in Massachusetts. There's only 6 federal medical prisons in the country. And so I was like, I have to take this opportunity. I would love to learn under these dentists in a totally new setting that I wouldn't otherwise understand how to even get a job there. So I started working there in my externship and worked there for about 4 months. Loved my experience, learned so much. And now I work as a consultant, helping bring and correct dental care provided to incarcerated persons. Right now I'm working on a project in California with my boss, who's a JD MD, and they got sued. So we're trying to fix the issues with their medical, dental, and mental health care that they're providing to their patients. So now I work more of a consultant role. I'm not actively doing dentistry on those patients.
I think it's so cool that you were like, oh, you're going to place us in a prison. Maybe I want to sign up for that, because a lot of people would be like, that's the last thing I want to do. I don't want to go into a prison. So what was your first day on the job, walking into a federal prison? What was your first impression of it?
So that's a super good question. I was obviously very nervous to walk into the federal medical prison on my first day. I was told to not wear any name tags or anything with my name and my identifier on them. I had to wear my scrubs. And I was most concerned, this is so stupid, that I wasn't going to be able to bring in my loops, which are my dental magnifiers that magnify everything that we're doing like 2 or 3 times. There was nothing online, and there was nothing provided to me that was going to tell me if I could bring those or not. So I was allowed, thank God. But first day on the job, we walk in, they screen us. I was a little bit surprised by how little screening there was of me. These people don't know me. I was not patted down. I put my stuff through the metal detector, but that was it. Theoretically, I could have brought anything into that facility. So that was a little alarming. That is something they fixed during my time there. So maybe it was just that officer. Anyways, we walked in, and how this facility is set up. Again, it's a federal medical prison. So the purpose of this facility was to give medical care. So we have a massive hospital on site, and dental is part of that hospital. There's obviously housing units that we all walk past, different types of housing units. We'll have kind of regular housing, general population housing that you walk past, and then special housing unit, SHU is what they called it there, and a large mental health ward as well. So you walk past all that. And I had to have an officer with me at all times to escort me around the facility. And we go into dental. And our first day, I had to leave early because the incarcerated persons who live above the dental clinic had clogged their toilets the night before and flooded it. And it just started seeping through the ceiling when we got up. So by the end of the day, they sent me home like right away. By the end of the day, there was 2 or 3 inches of like pea water on the floor. So my first day and second day were very different than the rest of my days. But yeah, I remember feeling just, I guess, a heaviness walking into the facility. I was less nervous once I started actually working with patients, like the first 2 patients I was able to see that day, because they're just patients, and all, those things just kind of come back to you. You're like, oh, well, let me take your x-ray. Let me explain the procedure we're going to do. So it becomes easier, I think, once I was in the clinic working with patients.
I think it's a little crazy that on your first day, inmates flooded the tier. That happens all the time, but for your first day, that's kind of a shitty first day, like no pun intended.
Bad timing.
Yeah, that's rough. If my first day
and these guys, I was gonna say, these guys too so we were in the medical building. So the guys on the floor above us, above dental, were like infirmed. They were very ill. So in order for them to do that together, obviously they're trying to make a big statement. I'm not exactly sure what that statement was, or what the purpose for that flooding was, but it took them significant effort to get them out of their beds to be able to do that, because they're in hospital beds. So that was a little different too, but
yeah, they must have been really upset. And I know a lot of prisons, if you have some kind of like severe medical issue, whether that is cancer or whatever it is, they'll send you out of a maximum security GP like prison, and they'll put you in these medical prisons. So just for me, I was pregnant in my last bid, so I wasn't kept in the maximum security prison. I was actually put into a medium security prison for a little while. I got kicked out of it. Long story. But there were a lot of other women that they were their cancer, or one woman had lost a leg, or they're dealing with old age. It was a very different experience than what I was typically used to. So as far as what you were able to do as a dentist working there, what services could you offer the inmates?
That's a really good question, because it differed from the federal prison to the state facility I'm working with in California. And there's some pretty drastic differences. And I just want to start by saying it surprises me how little providers are given in terms of like rules of what they can and can't provide to their incarcerated persons. What I mean by that is, federally, there are very strict regulations. For example, if someone needs a denture or they need their denture remade, they're only allowed to get their denture remade every 10 years, once every 10 years. That's like a hard and stone, rule. And your sentence has to be longer than 3 years in order to even become eligible to receive a denture. Dentures take 6 to 7 visits. It's just a significant amount of work to get that denture customized to that patient. So maybe that's why, but so federally, there's a lot of rules. Basically, what we could offer in that facility, we did oral cancer screenings. I didn't see a biopsy. I didn't do a biopsy, so I'm not exactly sure for biopsies. I think they send those out. We did a lot of extractions, so removal of teeth, back teeth that were heavily cavitated, had really big cavities into the nerve space. In private practice, we might be able to do a root canal or do a filling. A root canal and a crown prep and place a crown on that tooth. That's not available in any facility that I've worked in. Crowns just don't exist. So we did extractions, we did fillings, we did mostly that, a lot of surgery. It was a lot of surgery. We did a lot of INDs, so people who are really infected, we drained incision and drainage of those infections. That was the majority of what we did. Now, that's very different from the jail that I'm working in. So I'm working in a county jail, system of county jails in California right now. And there, in those facilities, we can do things like night guards. We can make patients night guards, which is really cool. If they have braces on, if they actively are going through orthodontics, we in that facility can actually send them out to go back and see their orthodontist in order to make the next corrections and kind of keep moving the case along, which was so different. Now, if you're in a federal prison facility, they're not going to be able to send you out for, orthodontic corrections. It's just a very different system. So
that makes me happy that California is saying like, oh, you came in with orthodontic care and you're mid braces treatment, we're going to send you to an orthodontist. in my personal experience, it was if you come in with braces and you're there for a certain amount of time, you can either leave them on and just wait until you go, until you leave. If you're a short timer, that would be okay-ish. Probably not. I'm not a dentist. Or you can take them off. And that was like super tough for the people that would come in with braces because you spend all this money. Why would I want to get them taken off? Well, if you're going to be there for 5-6 years, you can't just leave them on your teeth, right? Like what would happen theoretically if, say, I had braces and I had 5 years and I left them and I didn't touch them for 5 years?
So yeah, that would just retain where the teeth are right now and keep them in that position. Now, where that gets difficult is the food that's provided. I don't think is the most easy to chew. I had a patient, and we'll probably get into this a little bit. I had a patient who fully cracked through his tooth, like splintered a perfectly healthy molar. Molar had nothing wrong with it otherwise, splintered it into 3 different pieces by biting into chicken that was overcooked because he said, oh, that day I didn't poke my chicken because I usually poke my chicken. I just bit it that day and he split his tooth into 3. And I'm like, what do you mean? That's chicken. I was like, it's a bone, a chicken bone. And he's like, no, just a chicken. They don't give us the bones. I was like, what?
Oh,
so it is very, if someone has braces, then how the heck are they going to eat that chicken? I have no idea. I don't think it's possible.
That makes me so sad. Yeah. I've seen tons.
It was really sad.
I've seen tons of dental issues in prison. And, often it's because we're using drugs and that severely, damages our teeth. Or I had Hep C. I'm now cured of Hep C, and again, I'm not a dentist, so definitely correct me if I'm wrong. I feel like the Hep C definitely impacted the inner health of my teeth. So I had a lot of issues and I actually start Invisalign. I'll have my trays in 2 or 3 weeks. I did all my molds and everything, but to get to that, I had to go through Hep C treatment. I have several crowns, 6, I'm a queen. So it took a lot of time and it took a lot of, pain to get there. But you have to remember, a lot of inmates are struggling with substance use disorder. Maybe they have Hep C like I did. So they're coming in off the street without having regular dentistry, without having insurance. And, I'm sure you've seen a lot of problems. What do you think was the worst case that you saw? And were you able to help this inmate or how'd you deal with that?
Yeah, so I have 2 that always stand out in my memory for most difficult cases dental wise that I treated. And the first, I think, goes into your point of these patients are coming from, maybe little to no dental background at all. They might have never been to a dentist. They might not have ever been able to afford care or known that it was important to go seek out care. So I had a patient, I want to say he was 55, let's say. And the story's actually a little bit longer. So I came in the morning and I sit down and I'm wearing my scrubs and my officer was a little bit late to come and get me. And I'm just sitting there and these 2 nicely dressed women are sitting next to me. They're obviously going to have their meetings, with their spouses or boyfriends or whoever. And they're just chatting to each other. And I happen to be sitting 1 chair away from them in this little waiting room, waiting for my officer to come grab me so then I can start the day in dental. One of the ladies was talking to the other woman. She's like, hey, yeah, I heard that my husband, boyfriend, or whoever was sitting next to this guy in the chow hall at lunch, and he lost all of his teeth at lunch. They just fell out. I don't know what these people are doing, this and that, what are the dentists here doing? And I'm sitting here and I'm like, I'm the dentist here. What do you mean he lost all his teeth? I haven't seen this patient. If this happened yesterday at lunch, I would have thought this patient would have immediately been sent to dental. I didn't see him yesterday. And I'm just sitting there quietly because, I can't ask them about his medical information. I'm I know who my first patient's going to be, right? This morning at sick call, it's got to be this patient. So I'm sitting there and they kind of turn and look at me and they see that I'm wearing scrubs. And one of the ladies kind of laughingly says, oh, what do you do here? Do you work here or whatever? And I was like, yeah, and I'm in dental. I was so embarrassed because what I didn't know about this patient. So I go back, first person at sick call. There was 8 other patients there too, waiting. First patient I saw was this patient who comes in holding his 4 front teeth in his hand. But actually they were in his pocket. He pulled them out of his pocket to put them in his hand. He goes, Doc, can you put these back in? And my heart just broke immediately because I'm if your adult teeth are falling out of your head, this is gum disease, this is periodontal disease. Right away, I can't put those back in. If they were avulsed, if they were punched out in a healthy mouth, then yes, you can put them back in within a minute, 30 minutes max. this is the next day. And so all the other inmates who were waiting were like, he's got to go in first. He's the most, he needs you guys.
Oh.
So we sit him down and I do a full exam. All of his teeth are so loose. Every single tooth has no bone supporting them anymore. I don't think this patient has ever brushed nor flossed. Also, floss is not allowed in federal prison, but I don't think he's ever brushed in his life. And so we had a conversation. I was like, sir, have you ever brushed your teeth? Do you know how to? Can I help you learn? Like, what can we do to help save some of these teeth if they're even possible? At this point, I don't think any of them were salvageable. And he's like, yeah, I see a lot of people on my floor doing that. I didn't know it was important. No one had ever taught him how to brush his teeth. My heart just breaks every time I think about him holding his 4 front teeth, and he's thinking maybe that more teeth are going to come through because that's what happened when you had baby teeth. Your adult teeth came through. Maybe he's thinking there's another set. Nobody's ever had that conversation with him. Literally breaks my heart every time I think about it. He was one of the most difficult cases because he's coming from 0 to 100, right? I'm trying to train him up on everything about his teeth. The other patient I think that stands out in my mind as the most difficult patient to treat was a very severely medically compromised patient. This patient was came in a wheelchair. We had a lot of guys in wheelchairs. Again, this is a medical prison, but he was in a wheelchair because he had such severe Tourette's. Tourette's is a mobility dysfunctioning disorder. So he has very rapid and large bodily movements all the time. Now, there are medications for Tourette's that work for a lot of people, depending on the tic and depending on what kind of movement that patient is struggling to control. Now, this patient has like allergies to almost every single one of those medications. We can't keep him on anything. He's so uncomfortable all day long because he's got involuntary movements all day long. So he comes in and he is so infected. Every single tooth is broken and chipped. He's biting into himself, chipping and breaking them just from the movement of his jaws. And his case is really difficult because his cheeks, his face, his body's moving. He's also got hepatitis C, active hep C. He had tuberculosis that was just diagnosed 2 days before we saw him. So he's just starting treatment. Tuberculosis treatment takes months. And I'm like looking at my boss, like, you want me to do what? How am I supposed to do a surgical removal of these teeth? He's moving so much. Can we sedate? Can we, he needs to be in an OR, but we didn't have the money that month to send him to the OR because I had diagnosed a lymphoma earlier in that month in someone's neck. That patient needed to go and get his cancer removed. So this patient, I had to do it, and I'm like sweating, moving with him as he's shaking. He's moving his jaw, his tongue, his lips, his cheeks, everything's moving, and there's blood everywhere, like literally everywhere. And we were both so exhausted. We canceled the rest of the patients that day. The patient was exhausted. My boss was exhausted from working this case, and my heart just broke because he went from he's so in so much pain. Like 3 days later, I saw him. He was a door holder, so he was holding the door open for us as we came in the morning. And he's like, "Doc, thank you. I feel so much better." And I'm like, "Why are you thanking me? I'm so tired. I was so wiped out." And I'm like, put everything into this, but it just breaks your heart because how else? I mean, he's so uncomfortable, but that always stands out. That patient was really hard to work on physically.
So they go by budgets. Like you couldn't send him to the OR because you had already sent someone else that had cancer.
That's what I was told. Yeah. Which is really twisted because hear this out too. Dental, every unit has their own budget for the month federally. My boss got paid like a lot, like 3 times what a private practice dentist gets paid. So they consider it a hard to fill position. So because of that, they pay you more and they pay you bonuses every year and all this stuff to keep someone in that position. It's considered just a hard to fill position. So my boss is getting paid a lot, just period. He has, I want to say like $9,000 per month as a budget. Now, what I spend in private practice for 2 dentists, 2 hygienists, the whole team of people in my private practice on supplies, instruments, everything that we might need is closer to like $4,000 a month. He has $9,000 a month, okay? Seeing way less patients than I see, doing less procedures than I do in my private practice. So there is money there, but I don't really understand how it gets spent because that obviously is over my pay grade. But I was told that patient who had a lymphoma, a visible, palpable lymphoma, had just been sent out, and it's a big to-do to send anybody out of this facility, get them to a hospital and get care. because already medical facilities, they have to like really need significant work in order to be sent out. And so they told me not this month, and he had an active infection, so we had to work. I mean, we had to treat him like right away. That's different though from the California facility I'm working with. They'll send somebody out like that, like, you know, within minutes. You're in an ambulance on the way to the ER. So I don't know why it's so different, but it was very different.
That's what's so hard when talking about prison reform and my prison experiences is every single facility is different. Every state is different. When we're talking federal versus state, two different worlds. So a lot of people will be like, you're lying. This was my experience. And I'm like, yeah, bro, in California, it's very different in Arkansas. Like no. I couldn't get fillings in Arkansas, and I had a root canal. Wow. And I'm never going to complain about my teeth ever again though, hearing these stories. But I had a root canal and a temporary filling put in that. And this was a long time, 10 years ago, probably. So I never went back for the crown because I just gave up with my dental work. I like sobered up for 2 months and decided to go to the dentist. Bad idea. A good idea. I should have followed through. But I went back to prison before I got the crown. And I went in because it was bothering me, and all of that filling was like gone out of there. And it was just so weird looking, and it was bothering me. I was afraid I was going to break the tooth in half. So I knew that I wasn't going to be able to get a crown. I was kind of hoping for one, but they just pulled it out, which is so unfortunate because you pay all that money and you get the root canal and everything. You should be able to get the crown. So in my experience, it was just extractions that they would do and dentures in Arkansas. I believe New York does fillings. But you know, it's so limited. And a lot of times, like, it's not up to you. You would fix everyone and give everyone crowns and root canals if you could. It's the policy, you know, like if you could save a tooth, I'm sure you would as a dentist. So a lot of times just bad policy, you know, ties your hands. And if I was working as a dentist and I was a dentist in a facility and I got paid bonuses and I was making all this money, I would take less money to help people. I would be devastated.
That's what I'm saying. Yeah.
It would just be devastating to see these people in pain every single day. And for removing the teeth, you can't sedate anybody, not even someone with severe Tourette's.
Right. Yeah. So there's no nitrous oxide at that facility, nor the California facility I worked at. Nitrous oxide isn't even full sedation. IV sedation, you need specialty training. So how it works federally is there is basically a regional coordinator for each different thing. So for example, we have a prosthodontics regional coordinator, like a chief of prosthodontics. Prosthodontics is dentures. That happened to be my boss. So all the dentures need to be approved by him in order to be placed in someone's mouth. And the patient needs to be missing a certain number of teeth in order to receive a partial and all that stuff. But same thing with oral surgery. So there's one oral surgeon for this whole region of federal prisons in this, you know, section or whatever. And so I don't know if budgeting I don't know. It just doesn't make any sense. I agree. And we go into this, you know, to help people, and those dentists were making a lot of money. I mean, a lot of money. And still sometimes their boss is like, I only want to see like 4 or 5 patients today. I'm like, are you kidding? And sometimes the workflow of the day is a little tough because the lunchtime for our inmates was 2 hours. So because mobility issues, we have patients in wheelchairs, it just took a really long time to get people through lunch. So that was a little tough because we couldn't treat anyone during that time. But I'm like 4 patients, 5 patients a day. I can crank out 10, 12 patients in my private office per day. We have the chairs, we have the space, we have the staff. Can we just see more? Like, what is this wait list? The wait list is a trouble topic too, but.
Yeah, the wait list in my experience was you fill out a kite or like a little letter, basically, to go to the dentist or mental health or the regular doctor. And then you have to wait. And for me, I think the wait time was about 2 weeks to get into the dentist.
Wow.
Mental health, it was anywhere between like 3 to 7 days, depending on like weekend or a federal holiday or what have you. Dentist was a little bit longer. I don't know if in the last facility that I was in, I don't know if we had an in-house dentist there every day. So I think that was part of the reason why it was a little bit slower. So what would you change? Like, what policy could you change today to make the most impact?
I wish there was more standardization in the care given in facilities. So you touched on it a little bit, that medical care and dental care is just not standard across the board. And a lot of our patients are in and out of different facilities, depending on, which county that they live in. They might be in this county jail system, for example, and then end up in a different one. And they don't necessarily know what to expect at each one of those facilities. And I just don't think it's that hard to standardize that. Federal regulations, for example, federally, we have a lot of standards. Why can't we just, translate that into all of these different state facilities, for example? Other things that I wish we would consider for our patients across the board is the little things. So what I mean by that is there's safety rules when you're working in a federal, or at least, federally, the jail. The California jail is a little bit different. They're working on their safety rules. They're trying to fix them, but I wish there was clarity for the dentist and for the providers about safety. So instrument safety, instrument counts, when to do those instrument counts, how to package instruments to make sure that they're safely away from patients before the patient's dismissed. I wish there was standardization on that, because I think it would make prison dentistry a lot safer across the board. But separately, also for the patient's safety, I found that the facility I worked in, the federal medical prison that I worked in, is like the only one that has a rule specific to patients in medical crises. So patients who are in mental health crisis in that federal medical prison that I worked in, if they have a partial denture, for example, a cast metal partial denture, that has to be removed from them before they go into their cell to be kind of observed during their mental health crisis. So suicide watch. If they're on suicide watch, they shouldn't have a metal thing in their mouth that they could potentially take out and hurt themselves with. And that really shocked me that was not standard thought process across the board. I think it was just my boss who was like, hey guys, we should take those out of people's mouths before they go into their suicide watch cell. And unfortunately, because we were a federal medical prison, we had a lot of suicide watch cells, a lot of people in suicide watch at a given time, because if those patients were unable to be managed by their other federal facility, they would send them to us to be watched. So I think he's making strides there, but I just wish there was more clarity, more standardization. I think it's a little bit confusing. And I think that talking about, care rendered in prison facilities and prison dentistry and, what opportunities there could be for dentists to work in those facilities, I think needs to be talked about more, especially to dental students, especially to rising people going into the field, because it's just not touched on. It was literally on a list of sites, and I'm like, wow, that looks like a really interesting site. Nobody else in my class signed up to work in the prison. Nobody in the 5 classes above me, nor 2 classes since I graduated, have signed up to go to that facility. And that's a bummer. That's a huge bummer, because how are we supposed to learn about it if it's not presented to us? So those would be the things I'd change right now.
So just to touch on what you said a second ago, that's why it was so interesting to me, that you're so young, you've been a dentist for like a little over a year, and you were like, yep, I want to go to prison. It's not something that you hear every day. And I just immediately loved you for that, because those people need the most care and the most treatment and the most compassion. And like, they've been through a lot in their lives. As far as policy, you said you want more standardization. Is that because the rules aren't really clear in every facility, so you're unsure of what to do?
Yeah, I think the rules aren't clear. And I think, unfortunately, a lot of patients, once they go into these facilities, whether it's jail or state prisons, for example, they don't know what to expect. I mean, you had mentioned they might only offer extractions. I did inmate interviews with my patients in California just a few weeks ago, and I asked them point blank, do you know what is provided here? Can you describe to me what kind of care is provided here, just to see if they knew what types of services we offer, because that facility actually offers a ton of different services, and they're struggling in a few places, but they offer a lot more than I've ever seen anywhere else. And all of the patients, all 7 of the patients that I interviewed, said, no, I think they just take teeth out. And I'm like, no, they don't. They do so much more. Even one of them was like, no, they just extract teeth. But I did bend my partial denture, and the dentist straightened it back out. And I was like, okay, so that's obviously very different than taking a tooth out, but you kind of see that there's something else. So I wish it was just standard, more clear to patients. I wish that the wait times were much shorter, and I don't necessarily know how to fix that, or if you can fix it with policy, because I know that's such a localized issue, like depending on the state or the location of that facility or whatever, it could be a significant issue. But I don't think anyone should have to wait 3 weeks, a month. We have some patients waiting 8 months for cleanings, just to get on their first normal cleaning for that facility that was working in the federal prison. So it's like, we're really waiting 8 months, but we always say, like, you know, patients with periodontal should be seen every 3 months. Why are we not seeing them? Can we prevent these problems? I don't know. That's where I get frustrated.
So I'm glad you mentioned cleanings, because inmates are allowed to have one cleaning per year. But you have to be there for a year first before you get your first cleaning, I think, or something like that. I never signed up because the dentist scares me. You mentioned a while ago that you don't have like sedation. You don't even have nitrous oxide, which is like laughing gas. Let me tell y'all, it's a little bit extra. Like, I think I had to pay $50 extra for like my root canals to get gas in the dentist. Pay the $50. It's worth it. It doesn't make me giggle. It makes me so calm. Like PTSD, who we don't know her. We don't know anxiety. I didn't know I was at the dentist when I got gas. I was just happy jamming out to my music. So get the gas. But can you talk about pain management and what you're allowed to offer if someone comes in excruciating pain, or they have some kind of serious infection? What can you give them, if anything, for that pain?
That's a really good question, because that also depends on your boss at the facility and the regulations of the facility and the pharmacology department that they have. So I'll talk to both locations as what they do for pain management. So in the federal medical prison I worked at, we have everything. I mean, we have all access to all pain management things that I would do in private practice. So I have all my opioids, I have, you know, strong Tylenol, I have codeine, I have everything that I might want to give to someone post-op after extractions or after surgery. The difficulty is that those patients, so in the federal medical prison I worked at, for every single patient, if I took a tooth out, I had to pack that site with a collagen plug. Collagen helps the site heal, and it helps close the wound and helps prevent bleeding. I had to pack every single site, regardless if they needed it or not, with collagen, and then suture. Everybody got sutures, because at that facility, the patients weren't allowed to go back to their cell with gauze. I think it was an issue with where do they dispose of the gauze, because that's a biohazard, and this is a communal, cell, communal block of people. I think it was an issue with patients, inmates going back, biting on their gauze after an extraction, just tossing it, throwing it anywhere. I think that doesn't really work from a cleanliness standpoint. So in that federal medical prison that I worked in, everybody got sutures and everyone got collagen plugs, just as a rule of thumb, to help prevent post-op bleeding. And everybody got pain management specific to their needs and specific to that surgery. So we had access to everything. Now in the county jail system we're working with, I'm observing and trying to correct their behaviors in California. They weren't giving patients like anything. I was alarmed when I was interviewing this one patient. She told me a very, very sad story about her friend. I didn't meet the friend, but this patient this incarcerated person described her friend's story and said, yeah, my friend got all 4 wisdom teeth taken out and they didn't really tell her what to do after. Okay, 4 wisdom teeth coming out, usually we're going to prescribe like Percocet to those patients. It's very uncomfortable, at least the first 2 or 3 days. They're not feeling good at all, right? They're very uncomfortable, they're very swollen. We give them ice packs. That's in private practice. Now in this facility, she had all 4 wisdom teeth taken out, and according to her cellmate, she didn't have any gauze, didn't have anything to stop the bleeding, was bleeding all night, wasn't told anything post-operatively to sit her head up or put ice on this area. Luckily, her cellmate, the girl that I interviewed, had ice because she had a knee problem separate to this dental issue that her friend's going through. She had a knee problem, and she was allowed 3 ice packs a day as part of her knee kind of healing process. So she was like, okay, take my ice, you should take it. Hello, why did the girl who just got 4 wisdom teeth taken out not get ice or an order for ice after that surgery? It's absolutely unacceptable. From her records that I'm auditing, because it's my job to audit those records and make those corrections, pain management was just not existent. She was given Tylenol post-op. That's it, like plain Tylenol that you might take if you roll your ankle. Okay, that's just not acceptable. That's not sufficient. It was not enough. She was spitting, up blood all night long. She wasn't told to bite down on gauze. It was just really a mess. So we're trying to fix them. We're working on fixing them. We're getting there. Hopefully this will not ever be a case that's ever going to happen again in that facility, but it was very different what we're able to offer. In the jail setting, they try to stray away from offering narcotics because a lot of the patients in that setting are coming in and out with issues addicted to opioids. So they were trying to stray away from that. But I mean, the reality is we just don't have that many great pain management options post-op for dental stuff. I mean, Tylenol and Advil, yeah, but she wasn't given anything. So
I think a lot of times too, like these policies are not written by doctors in the prison.
yeah.
So the people that are in charge of these facilities, they don't have medical degrees. They're just like, oh, most people are addicts, no pain management. Well, just because we struggle with substance use disorder does not mean that we should be left to suffer because we struggled with addiction. And I get this question all the time on YouTube and TikTok and Instagram. Jess, you have 10 years in recovery. What happens if you break your leg? Or I just had my wisdom teeth taken out. I got dry socket because that's my luck. I was in excruciating pain and only took, I took ibuprofen, but I had clove oil or clove paste or whatever. Love that stuff. But like if that happened, I had my breast augmentation surgery, and I was able to just take Tylenol then. But if I'm in excruciating pain and something bad has happened, I'm going to take something to make it feel better. And that's not a relapse. That's using it the way that it was intended. As long as this is monitored, and those people in prison are, if they have oral surgery, you need pain medication, you need an ice pack, you need these things. And, the people at the top are like, they're all addicts, make them suffer, essentially, because what if one inmate kept the meds and didn't swallow them and took them back and hoarded the pain medication and then overdosed and died? Worst case scenario. But that's the thought process that goes into making these policies that say you can't have pain management medication because of substance use disorder, or they could keep them, cheek them, tongue them, and then sell them or overdose or whatever. That's the only thing they care about. They're not thinking about, the problem holistically. They're not thinking about, okay, the patient needs medication. They're literally just thinking about an overdose or the patient misusing them. That's the only thought that goes into it. And that is just heartbreaking. I've seen people in excruciating pain left alone to suffer, whether they're detoxing off drugs. I've seen people have seizures and not get medical attention for hours. I was left alone in active childbirth for hours. It happens all the time in prison. And, I think conversations like this are so important because I don't know if people really understand what's going on behind those walls. That's why I definitely wanted to touch on pain management with you, because usually it's like buy a Tylenol off commissary and deal with it. Like,
yeah, and if you can afford a Tylenol, like you're kidding, right? Yeah. So we had to change that. We're also working on toothbrushes. I don't know what your experience was with toothbrushes from commissary. If you got free ones, describe that to me, because I really want to know what your experience were. You're in a few different facilities, and I've seen like a whole slew of different things, but let me know on that one. What did yours look like?
So the state issued toothbrushes are about this big. They're really small, and it's very hard to get back in there with like toothbrush that's like this big. But you could buy toothbrushes on commissary that were standard size, which was awesome. No electric toothbrushes, which clean teeth better. Can't have that. Some facilities have floss loops, which are essentially just little rubber bands, and they hurt. It's like, that's not a good feeling. So what I would do for floss, you're going to die. I would take my shirt and I would take the thread out of my shirt for floss, and it worked better. And it didn't hurt as bad as a rubber band going in between my teeth.
I mean, that's commitment. So I commend you.
I like to floss
because what I've experienced was really interesting for what they offer. So in the California jail that we're working with right now, every single inmate that I interviewed was like, these toothbrushes are the worst. And I've been at other facilities and they're better. And I'm like, okay, show me. So I literally had one of them go back to their cell and show me. It's a little finger brush just on the tip of your finger. And it's a safety brush. Great. It's who's it keeping it safe? The bacteria on their teeth, because those guys are safe because they're not getting cleaned off. It's this tiny little toothbrush that we use for literally toddlers who have 2 teeth. Okay, that's when it's indicated. I was a little bit alarmed. So we're fixing that. But in federal, because it was a federal medical prison, you touched on this a little bit, we have all levels of security needs and all levels of mental health needs and mental health crises, levels and stuff like that. So we had about 6 different toothbrushes that we could offer patients, but it was always a little bit tricky of what to buy. So I'm a little surprised that they give you a full size one, because we got in big trouble for doing that, because we got all these bright green, Colgate toothbrushes. We ordered a whole slew of them and gave instructions on how to brush with them, and patients were loving them. And then all these bright green shanks started showing up all around the facility. And my big boss, the warden, was like, "Where did these come from? What is this bright green thing that, you try?" The officers meet if ever there's a shank found. I don't know if you knew this, but every time there's something found, something dangerous found on a patient or an inmate, or wherever they find it, they send an email to everyone with a picture, trying to figure out where they could have gotten the supplies to make it from. So all these bright green ones are showing up. My dental boss was like, "Those are the toothbrushes." So we had to get rid of them. But so now they offer these tiny, like you said, 3 or 4 inches safety toothbrush. I don't think it's plastic. I don't even know what it's made out of, but I agree with you. I don't think there's a good way to give patients something. There's dental health is just not really a great option. And the toothpastes are really expensive, and string floss. I don't know if you had that, but it was not allowed federally. Somebody tried to escape in the 80s or something with string floss and almost succeeded. So it's an interesting sort of look up, but that's why they don't allow it anymore. So I think it's too bad, but
They called them in Arkansas dental loops. And I don't remember what we had in New York. I just remember, and I've been in a lot of facilities, I've been in a lot of different facilities in New York, Arkansas, Texas. I was arrested in Kentucky one time. I've just always used the thread of my shirt for eyebrows and for floss.
I love it for eyebrows.
Yeah. Have you ever seen eyebrow threading?
Yeah.
I'm so good at it. If you need anyone, I am taking clients. I'm just kidding. But yeah, in Arkansas, it was the dental
Pull
loops.
your shirt apart.
I wish I could remember what we had in New York. Maybe someone can post in the comment section. I don't remember it. I know we did not get floss, regular floss. I don't even think we got mouthwash. If I remember correctly, there's no mouthwash on commissary.
Okay, there is in the 2 facilities I worked at, but there's not things like oral gel. So if you have pain in your mouth, that's not an option. Fixodent, meaning denture glue, basically keep your dentures in for people that have loose dentures, was not available on commissary for the California facility I'm working in. It is available in federal facilities, but it's $7 for a tiny little tube. And in private practice, I know how much Fixodent patients go through on a regular basis, and that is not a lot. That tiny tube for I don't know, $10, it's going to last you a week, maybe. So
we did
have money.
It's a lot. And these prices are so high in prison. That's how they make money. They make money off commissary. We did have the Fixodent. I remember seeing it on the commissary sheet in almost every facility I've been in, I'm pretty sure.
Okay.
Also, women would use it for arts and crafts. It's good glue. So good glue can't go to waste. But yeah, I definitely remember that. And I remember the cleaning tablets that dissolve for dentures. I'm pretty sure I remember that.
Nice.
Man, dentistry is so rough in prison. And to be honest, I don't think that a lot of, policymakers or people in charge of prisons see it as a priority. Their priority is keep inmates alive. So that's why if you're on suicide watch, you get stripped of all your clothes, put in a turtle suit or a pickle suit, whatever you want to call it. And you're they take your glasses away, you're partial. If it has a metal piece, they take that away from you. And you're literally kept in a cell and you're watched. And it is horrifying because they're worried about preserving life. And they're worried about making sure this inmate does not take their life. Their mental health, not a priority. Dental health, not a priority. It's keeping this inmate alive. So there's no lawsuit of, they took their life or they were killed on the, in the unit or what have you. And that is a horrifying reality of prison. When we first started, you said when you walked into this facility, you had this heavy feeling, and that is so real. You feel that people are suffering here. You can feel that energy. It is so dark, and there's no video I could ever make to describe it. There's no show you could ever watch where you could feel it. It's this heavy, just darkness around you when you walk in. And eventually that kind of fades as you build rapport with people and you kind of put that in the back of your mind. But that first day is heavy and it's really tough. So do you think people could escape with floss? I know that's a really random question. But shouldn't we
I
give
don't
floss?
think so. My thought is if you're able to escape with floss, like you deserve it. Be free. I don't know. That's
Just
what
let
I
him
think.
free.
And there's also like, the officer's job in that facility, for example, if you read up on that case, their job, I mean, they're supposed to like touch the bars at least once a day. And our facility is supposed to be 3 times a day. It's like, hello, who's not touching any of these bars like at any point in time that they're able to floss through metal? No, I just think it's crazy. I don't know. I think it could be a safety concern, from a ligature standpoint. People could harm themselves. They could harm others potentially if you get enough floss. But I just think it's sad. I mean, I think it's not something people expect. I think they go into these facilities and, like you said, we need to keep them alive. And that's the care that we're able to provide too. It's baseline care. So I think where my comments on my TikToks about prison dentistry get me every time is people get all upset and they're like, well, I'm a private paying citizen and I can't afford my dentures. And I'm like, okay, but first of all, the dentures that we're making in a jail setting or in a prison setting aren't going to be as nice as what you're buying on the outside. Literally, the other inmates in another jail or prison setting are setting the teeth up and putting them together and processing these dentures. Like they're not going to be done to the same level. Don't commit crimes to get dental care done. We have options available to people, in private practice, but out in the real world of people who are free world, I don't know. That always drives me crazy. But yeah, I think if someone can break out with floss.
To add on to your point, people are like, oh, they're getting free dentures. You don't understand the wait time and the pain that they had to go through just to get those dentures that are not high level quality, but they've had to have their teeth extracted after waiting months and being in horrible pain. And I've seen these people every tooth in their mouth has to come out and they're in excruciating pain. They can't eat, they can't sleep, they can't take pain meds, and they're left on their rack or on their prison bed for, months on end, just suffering. Then they finally get their teeth extracted. They have to heal in prison without real pain management, without anything. And they're just in excruciating pain. And then months after that, then they get their dentures. So it's not like you can just go break the law and in a few weeks, you're going to have dentures. Like, bro, no, don't do that.
And even then, when that final denture is placed, they're only allowed to get a new set of dentures every 10 years. So at least in the federal system. So I had a patient who was in for, I think he had 35 years or something, 37 years, whatever his sentence was. And he was new on this sentence. So it was like more the beginning part of his sentence. And I met with him and he had 3 natural remaining teeth and they all bit together right here on the corner of his smile. He smiled, you could see the 1 upper tooth and the 2 lowers. And so he comes in for a consult and I'm like, hey, obviously you would be eligible for dentures. And, we should probably consider that. You have enough time in your sentence with something you have to look at. And he's going to be in our facility for other medical things that he would need. So we have physical time to see him. And he'll be with us long enough that we can make the dentures here. And he's like, no, doc, no, I'm good. I only get him every 10 years. So I want to stagger it and space it out in a strategic way. He wants to be strategic about when he gets that first set so that it lines up that when his last set is due, it'll be right before he's released so that he can smile for his family with the newest, cleanest, prettiest set of dentures. And I'm just sitting here like, but how are you eating? You have 3 teeth that are biting together. And he's like, nope, I can still eat corn on the cob. And I'm sure he is. Like he's chewing chicken and stuff, but my little dental heart's like breaking for this guy. I'm like, but he's going to wait, 5 more years to get this denture so that he can time it so that his last one is before he leaves. We shouldn't think like that. Who's thinking, why do we have to think like that? That's crazy.
I just want to hug him. Like,
yeah.
I don't even know him. I just want to hug him.
He was really cute. Yeah. He was really sweet. He was a great patient.
Oh, that's another thing. You can't just hug your patient, like your heart breaks for them and you get to know them and you can't hug them. Could you imagine if you just walked into a prison and saw a dentist hugging an inmate, you'd be like, excuse me. But my
boss was so strict on that too. Yeah. It's like, don't tell your patients, private. I was getting married the year I was working there. So everybody, I was like, no, I'm getting married. And they're asking about the wedding. And like, why not? These are people. I don't think he sees them, our patients as people or that they have lives or that they're looking forward to stuff. And so that was a little different. But
in my experience,
I agree. I wanted to hug a lot.
Yeah. In my experience, the guards that maybe did tell us, like, oh, going to a cookout this weekend. What are y'all making? What are y'all cooking in here? Those guards that just talk to us like human beings, they were the most respected and they didn't have anything to worry about when it comes to safety, you
Yeah.
know? And I think that is just so important. I will always remember, I might not necessarily remember what a guard said to me, but I'm going to remember how they made me feel. So I can remember certain conversations, but if a guard was just genuinely nice to me, and showed me a little bit of compassion and talked to me like a regular person, I'm going to remember that officer. I had an officer at 18, he's like, "Hey, Kent, how much money you make selling drugs?" I'm like, "Who are you?" Like, "A lot more than your salary." He goes, "Well, I've just been thinking about getting into it, and he just talked to me about it in a really funny way. And my 18-year-old, I think I'm bad self started to chip away, and he just built a rapport with me. And over time, I could see that like that was his strategy to try to get me to not want to come back, and he was
Yes.
just like, "You're so smart and you have so much more to offer. You don't need to be selling drugs. Like, you could do anything else." To have a corrections officer say that to me after, I've experienced a lot of bad ones, I can even see his face. I will always remember how the officer talked to me, and that kindness, like, I'll never forget. And I think when we're working with inmates, we need to remember that. We need to be compassionate and understand that like they're people too, especially when it comes to dentistry and medical care. So, is there anything else that you want to add before my camera turns off and I take my kids trick or treating?
I don't think so. I think we covered a lot.
I think my audience is going to have a lot of questions for you. So if you don't mind coming back, we would love to have you. And if you guys want to leave questions for Dr. Ashley, please leave them in the comment section down below. These conversations are so important to have. And I just love you. And I love that you're like the only person that was like, "I'm going to go to prison and I'm going to fix teeth in prison," because it's just, you're a unicorn. You really are. And we need more unicorns.
Thank you. Well, it was awesome chatting, and I can't wait to answer your guys' questions.
All right, you guys, I'm going to end this podcast / YouTube video. I don't know where it's going. I'm going to end it here. As always, I love you guys. Stay safe, stay in recovery, whatever that looks like to you. Don't go to prison to try to get dentures, and I will talk at you in the next one.